So the recommendations for men are always going to take into account the fact that most men are not really going to be able to adopt a very long regimen on a daily basis. So I always try to keep that in mind. And we try to pack as much punch as possible in a few key products. I like to tell patients about the Holy Trinity, which is like a moisturizer with skincare, maybe an antioxidant, and then a retinol at night. This really does accomplish most of the goals that most men are really interested in achieving for their skincare, and they complement their procedures very well as well.
Keeping it simple is certainly key for guys, right? We love those Swiss Army knife products that can do so many different things. Terrence, when you're starting to consider, skincare, you see a gentleman, you maybe do some neurotoxins, some filler, laser work, and now it's time to kind of support that investment with at-home skincare. What are you considering?
Yeah. I think Corey did a great job of highlighting how, the behavior of men is different, but the biology of the skin is different. And really the kind of the ultimate player of the biology is it's just how important sex hormones are on skin function. So, men obviously have a lot more testosterone, and that can have some positive things. So men have higher amounts of collagen, the skin is thicker, but testosterone potentially also plays a role in how we respond to oxidative stress. So men have higher rates of oxidative stress, and that may play a role in why men in general respond more poorly to all cancers, including skin cancer. So skin cancer rates are higher in men. Men also have a higher rate of UV-induced immunosuppression. So these are some few biologic factors that I think about. So what does that mean in terms of skincare? Well, number one, I think Corey's right. Let's keep it simple. But a mainstay in my recommendation are antioxidants. I think antioxidants are key, and particularly in men, because once again, highlighting men have higher rates of oxidative stress, higher rates of skin cancer. So antioxidants are critical from an anti-aging perspective. Um, retinols are really important because men, can potentially also tolerate retinols more. Sometimes in my female patients, I may or may not be able to implement retinols. They have this, everyone's heard about retinols. Everyone wants to use retinoids, but men can often tolerate it a little bit more because of the increased sebum production due to testosterone. And then lastly, in terms of moisturizers that Corey mentioned, we have these kind of two classes now of moisturizers. You have the kind of traditional cream moisturizer, which are preventing evaporation of water. Those are your lipid and water-based kind of classic moisturizer we think about. I tend to skew farther away from that for men because men tend to be oilier in general, but keeping hydrated is important. And men actually have lower amounts of water in the skin, even though they have more collagen, even though they produce more sebum. So that this is where HA products, HI hydrators, I find are really home runs for our male patients.